Alrighty. Mm. Well, welcome in. Today I'm going to be talking about somatic therapy and its techniques. So, a little bit of an overview of what we're going to get into. So, we're going to talk about key concepts and just general steps, some common theories, and then some more detailed explanations of certain theories, along with intervention examples and um, added recommendations that are related to somatic therapy, but not necessarily somatic therapy in and of itself. Okay, so what is somatic therapy? Somatic means relating to the body, and so somatic therapy as an approach is the integration of the mind and body, right? So oftentimes, talk therapy specifically focuses on just the mind, and so somatic therapy brings those two pieces together and it uses it to make sense of people, right? So, harm is defined as trauma and emotions stored in the body, and the impact of that is that it can turn into psychological or physical symptoms, right? So, PTSD, and then there's research that has been conducted that talks about how PTSD is connected to things such as chronic pain, right? And so healing then is defined as being able to release any of the trauma or emotions that are stored in the body. So key components of somatic theories in general are, like I said, centering the mind and body connection, that there is no hierarchy. You need both to heal, and you cannot ignore one part um, of a person. And then talking about how harm is stored in the body, that it's not just something psychological, and the storing, depending on the theory, will give different language to how specifically the trauma is stored, right? Or what is defined even as trauma. And then common components of these different theories are body awareness, so being able to have knowledge and increased attunement to what is happening within the body, the releasing of tension, trauma, emotions, just release of the body, and then restoring balance, right? So once you have the release, you take that information, you take that process and move forward in a new and different way. So, like I said, these different theories will have their own particular language. In general, though, these steps are a summary of what walking through somatic therapy would look like for a client and a therapist, right? So, starting with awareness, which is gathering data and learning about the self and the body. So it is simply information gathering. It is not any type of manipulation. And you pay attention to things such as your bodily sensations, your tensions, your discomfort, your emotions. It is simply increasing the amount of knowledge that one has with their own body. Then grounding, the next piece is to establish safety and presence. And what that could look like is turning attention to the senses, movement, deep breathing, even nature, right? Like why I chose that picture is because oftentimes nature can be a helpful grounding point. Things like trees, water, the sun, what have you, right? Or just even your immediate environment. Tracking is tracking is identifying patterns and then beginning to make meaning or understanding of the data that you're gathering, right? So you're observing any shifts that are happening and you're correlating when these shifts occur, right? And you notice changes that happen, right? And common changes could be changes in temperature, tightness, energy flow, just any type of physical changes that occur within the body. Resourcing is when you guide the client to gather positive, supportive, strengthening memories, people, places, what have you. And the whole purpose is to help the client feel connected to a sense of inner strength, emotional stability, even safety, right? So it's like you're gathering the resources before you get into anything distressing, which leads into the discharge phase, right? So being able to release the tension, the emotions, the stress that is stored in the body in any type of way that the person feels naturally inclined to do so. So this could be things like screaming, crying, even throwing up, right? So like a what shaking. And I'm not saying that this has to be in the session, but just encouraging the client that if they're safely able to do what their body naturally wants to do, that is typically what discharge is. And the whole point is to allow folks to complete their stress or emotional cycles, right? So, because oftentimes emotions, if we allow them to, they'll have a beginning, a middle, and an end, right? And folks get stuck in the middle of having that emotional release, or even get stuck in a fight, flight, freeze response, where, again, if we allow ourselves to, we can have a beginning, middle, and end when we are in that survival state. And so discharge is to be able to go back into the middle where we were frozen, and then come and release that feeling that we are in. And then integration is now that you've had the release, now that you have new information, new data, and whatnot, you move forward and bring together all these pieces of information of yourself, and kind of process the new awarenesses, understandings, and whatnot. Now, this is where how we know of traditional talk therapy to be. This is where that can fit in, where you can guide a client through processing, or you can even encourage them to process on their own too, like with activities like journaling, mindfulness, or if you're in session, validating the client, right? And so um, these are in general the steps. They're not necessarily linear. You can go between one or the other. And this is in general how you want to go about the steps, just because you want to be able to gather information and positive resources before getting into the distress. But as I'm sure you know, clients will go where they naturally go, right? And so this is where you can use a little bit of that discernment. So common theories of somatic therapy include sensory motor psychotherapy and accelerated experimental dynamic psychotherapy. So SP tracks how the body holds patterns and habits from attachments and past experiences. It's built on the Hakomi method, CBT, and neuroscience, and it defines harm as trauma leading to physical effects in the bodies, such as how the body, like the body posture, and just different body expressions. And how healing happens is there's typically three phases. One is you stabilize and have a symptom reduction, so which is you are kind of like doing that grounding, like I explained earlier, right? And getting the client into a safe space before then getting into the second step, which is working with the trauma memory, which is like kind of that discharge piece that I was talking about, and then the reintegration process. And then AED defines Oh, so AED talks about how emotions, if you allow yourself to fully process them, they are actually helpful and necessary when it comes to growth, transformation, and healing. And so harm happens when that processing is interrupted, and oftentimes when the person is alone. And so and there's like harm that occurs within particular relationship dynamics, right? And that can lead to what is called an unbearable aloneness, and the emotions that the client is facing are feel overwhelming. And so healing happens within the therapist and client relationship, right? So that relationship is the tool in order to help the client move through and process those um those emotions that were occurring in the aloneness. And so not only is the therapist guiding the client through the processing experience, the therapist would also share observations or their own um, sentiments that come up for them as a means of healing too. Then EMDR is another form of somatic therapy. Now, this particular approach has a very structured um, way of defining healing and providing treatment. So, with this, therapists need to be trained and certified in EMDR, and there's not too much wiggle room or flexibility when it comes to the process of providing EMDR therapy. And so, um, EMDR defines harm as kind of like what I've been saying, right? So emotion, stress being stored in the body and not being able to release it. And healing happens through bilateral stimulation, and then it's broken down into these 8 phases that I have listed here. So EMDR is typically recommended in person because you have to engage all of the senses to engage in order to as a means of healing, right? And so it's not to say that it hasn't been adapted to virtual, but because you have to activate the client's senses, it's typically recommended and easier when it's in person, right? So bilateral stimulation is where the client has all of their senses activated, and the activation happens in a back and forth manner. So typically, or one way that it can be approached is like the client will have sensors that go into the palm of their hands. They will have headphones that go on their head, and then there will be a beeping sound, and so there will be a beeping sound that occurs, and then there will be a flashing light that will go back and forth on a particular like monitor, right? And so all of these pieces are activated simultaneously in a rhythmic manner. So when the vibration occurs here, the light is here, the beep is here, and then it'll switch over to this side where everything again is activated on this side, right? And so the therapist will walk through a client and teach them a state of calmness. Now, this isn't like EMDR language, this is just me kind of explaining it. So the therapist will walk a client through kind of a safe place, safe memory, and establish a sense of safety before then getting into trauma memories. And the whole point is to basically desensitize the client from a trauma memory where it's like if it was a distress level of 10 out of 10, right? The whole idea or purpose is that you are systematically exposing the client to the trauma memory until that distress level gets to a 0. And then the Hakomi method so the main tenets are based off of a bunch of these different practices that are both psychological and non-psychological. And it focuses on the experience over the explanation, right? So it's less about what explicitly happened or what is factually true, and more so about what feels true to the clients and about processing whatever that emotional state is, right? And so this theory uses the language of core materials, which means that there are formative experiences that lead to a person developing their attitudes, their memories, neural patterns, beliefs, and these things are organized internally in an automatic way, right? And so harm occurs when a person has a missing experience or does not have part of the core materials that are necessary for them to live their life. And so then how does healing happen? In general, how healing occurs is within the therapeutic setting, you are creating new experiences through what's called experiments, right? And you unpack discoveries to establish practical connections to the real world. Now, what that means is that it's not just about being in the therapy space in a vacuum, it's about whatever it is that we're processing here, whatever it is that's coming up here, how can we get it to then apply to your life at a on a practical level, right? In a way that works for you, in a way that's usable for you, right? And so you provide the missing experiences and you're able to provide what is necessary for the client to live a fulfilling life. And then somatic experiences, again, built on an intersectional approach that's not just psychological, but has all these other sciences, including indigenous healing practices. And a lot of the work is also focused on what Dr. Peter Levine developed. And so it focuses on the nervous system and dysregulation and trauma. Sorry, my cat decided today and right now is a great time to be acting up. So it focuses on how trauma and dysregulation happen within the nervous system. And so harm happens when a person is stuck in this fight, flight, freeze state. And then how healing occurs is when, can you, excuse me, could you not? And healing occurs uh, when the therapist is able to engage in what's called pendulation. So it's going back and forth in the different states of the nervous system. So in the activated and calm state. And the whole point of this is to help the client um, feel encouraged and empowered in their ability to get themselves from an activated state to a calm state, as well as unfreeze them from wherever it was that they got stuck in, right? Okay, so bringing back this slide, I'm going to get into the intervention. So this is just kind of a refresher, right? So awareness, grounding, tracking, resourcing, discharge, and integration. So awareness, data gathering, grounding, establish a presence and safety, tracking, pattern recognition, resourcing, get the tools, get the things that help promote safety, strength, and empowerment, discharge, release whatever language is used, right? Release emotions, trauma, stress, what tension, right? Release, integrate, bring everything together with new insights and understanding so you can move forward in a new and different way. So, some examples of awareness and tracking. And just to kind of caveat this, right? So, like, I organize these interventions into these different categories, but a lot of interventions have more than one purpose, or not more than one purpose, have more than one effect. And so even though the body scan and this chart is here in awareness and tracking, it can also be a form of groundedness too. And you'll kind of see why, right? So a body scan is where you systematically go through the different parts of the body and pay attention to the body in a more detailed way. And you can, some things that you might want to focus on are where is your tension, constriction, calmness, like just anything that's happening within the body, right? And so I'm going to, and another piece that I will do is I will kind of walk you through as if you are my client, or I will say I will use the language or walk you through the examples so that way you can kind of get an understanding or get examples of language on how would you practically do this in the therapy space, right? So I typically with the body scan will start open-ended and kind of use it as an assessment, right? So I'll just tell people like what's happening within your body? What are you noticing within your body? And I keep it open-ended to start so I can see to what level of detail does the person give me information about their body, right? How much attunement do they already have to their body? If they have a lot of information, I typically don't supplement. I typically leave it as is, right? So if they're telling me a slew of things that is happening within their body and they can and I see that they're even changing states right in front of me, right? Like they had tension and now all of a sudden it's gone. Okay. Or like their face was I assume tension, right? So their face was scrunched up and then all of a sudden it's not. It's like, okay, they're moving through the different states of their body. They seem to be well aware. But if the person is struggling or doesn't give as much data, and have been working with them enough to recognize I can push them a little bit or challenge them a little bit more, I will provide more structure in the body scan, right? So I start with what are you noticing in your body? Okay. And then if I'm trying to get more from them, the structure is I will say, okay, what are you noticing from the top of your head? And also as I'm saying this, I invite you to walk through and do the body scan, right? Because one thing that can help too is the more that you have knowledge of your own body, the more you can guide someone else to gain knowledge of their body. So I encourage you, do what you want, right? But like I encourage you that as I'm saying the body scan aloud, that you do a body scan too, right? And I'm just going to switch into as if this is a client in front of me. Okay. So from the top of your head to your shoulders, what are you noticing? Any lightness, any heaviness, any aches or pains? Is there anything happening in your temples? Any pressure, any runniness, any dryness? Anything else to add? No? Okay. Now from your shoulders to your hips, what are you noticing? Okay. And this includes the arms. So check in with your joints. Notice your shoulders. Notice your elbows. Notice your wrists. Are there any aches, pains, tension? Notice your chest. Notice your breath. Can you feel your heartbeat? How's your breathing? Is it fast? Is it slow? Is it restricted? What about your stomach? Are you noticing any hunger, fullness, bloating, heaviness, lightness? Anything else to add related to from the shoulders to your hips? No? Okay. Now from your hips to the bottom of your feet. What are you noticing? Okay. Pay attention to your joints, your hips, your knees, your ankles, any aches, any pains, any lightness, any heaviness, any pressure. Okay. Anything else to add? Okay. Anything else to add from the top of the head to the bottom of your feet? No? Okay. And then I'll typically invite the client to reflect on the process, right? So, like, how was that for you? Do you notice anything from when we first, or from before we started checking into the body to now? Now, typically, people will feel different, right? Like, I know that as I was saying this aloud and guiding you through this body scan, I was doing one myself, and I do feel a difference from before I started the questions and after, right? So, and that's what I mean that interventions can have more than one use, where the body scan was to gather data, but it also had a grounding effect. And so, excuse me, this chart here, the CBT and somatic tracking chart, I, sorry, my cat is distracting me again. So I had created this chart because, and this is where like integration is very helpful, right? So I created this chart because in CBT, you're already tracking your thoughts, your feelings, your behavioral responses, right? And so I just wanted to make it simpler for clients and for myself to, um, or by adding just a bodily section, right? Bodily response section. Because again, remember the steps. At some point, you are going to do pattern recognition. And what better way to just have all the data together, right? And so I typically introduce this chart at the end of session because I typically want to focus on what the client wants to focus on, and I don't want to take up too much space by explaining this chart. So again, I'm going to walk through and explain this chart as if I were to have a client, if you were my client, right? So I'll explain uh, the reasons why it's important to track your information, right? So I'll say, actually, I'll just say the whole language now, right? So this is a chart that where you can gather data about yourself, and the whole point of doing this is so that way you can learn yourself better. And once you learn about yourself, you then begin to identify what you want to change and what is working for you, what's not working for you. And so this is just a good starting point to learn about yourself in a new and different way, right? So I'm going to fill this chart out for this moment, right? So it is 3:26. We are in session because you're my client. The thoughts that I'm having are the words that are coming out of my mouth. And also, why is Pascal deciding to do things right now? Those are the thoughts that I'm having. The emotions that are coming up for me. Now, this is typically where I pull up a feelings wheel and I will explain the feelings wheel, right? So, and then the language that I use to explain a feelings wheel is so, um, oftentimes, when people are building a new and different relationship to their emotions and to their feelings, common challenges are that they don't have the language for it, whether it's hard to remember, don't really know it, or it's just hard to think about it. And so the feelings wheel just is a helpful tool to give people options on how to label their experience. And labeling experiences is helpful and important, an important part of the process of connecting to your emotions. So this feelings wheel is a starting point, it's not the end point. So if there's something that you're feeling that is not on the wheel, that doesn't make it wrong. It just means this is just for people to have exposure to the language, right? So I pull up the feelings wheel. I'm feeling pretty content right now, maybe a little bit tired, but those are the emotions that I'm having, right? So behavioral responses, what am I doing? What I'm doing right now is I'm explaining, I'm moving my hands, and my bodily responses are now typically I don't walk through a body scan before this chart, right? So then I'll do a quick body scan in the session, right? So I'll say, I'm noticing a light tension in my head and a little dryness in my throat. Um, and so again, the whole point of filling this out is to learn and understand yourself in a new and different way. And then sometimes you can even use the information that you've gathered, right? So I just right now said I have a light tension in my head and a dryness in the throat. That kind of clues me in that maybe I'm dehydrated. And so I'm going to keep drinking my water in order to address what it is that I observe, right? So that's that. And then grounding. So I'm going to start with the five senses activity. It can also be called the 5 4 3 2 1 activity. And why I'll start with the five senses activity is that because it can be embedded into the four elements activity. So again, a lot of these things are flexible. A lot of this you can kind of use what works, take and manipulate it in the ways in which you want, or that it works for you or your client. And there is no um, necessarily structure that's needed for it, right? So for the five senses activities, so I like to kind of make a little bit of a game out of it. So I'll ask the client, what's your favorite color, right? And then we'll go through and use that information. So I'm going to be my own client. My favorite color is red. So you start with five things that you see. And again, I like to add the layer of a color, five red things that you see, right? So I see the top of my water bottle. I see a pencil case. I see a pen. I see the zipper of my backpack and a book back here. Four things that I hear. So I hear myself talking. I hear my cat's water fountain. I hear the train. Mm. Hmm. And I hear the AC blowing. And then three things that I feel touch sensory wise, right? So texture. I feel my foot bent over my knee. I feel my water bottle sitting on my lap. And I feel specifically, I feel this sleeve right on this arm. So I think I'm actually going to put it down. And then two things that I smell. So I smell my hair products and I smell the detergent. And then one thing that I taste my saliva water in my mouth. And so that's the five senses activity. And then again, this activity can be used as the earth element of the four elements activity, which the purpose is to get some groundedness, some presence, and a sense of safety. Then you move on to the air melt element. And so that it can be breath work, and the whole point is to center oneself. So when it comes to breath work, this is where it's important to know your client because sometimes breath work, especially like the more advanced type of techniques or doing more intense manipulation of the breath, can actually be activating for folks. And so typically, how I like to do an assessment or a check of a client and seeing where they're at is to ask them to demonstrate taking a deep breath for me. Or, yeah, deep breath for me. And so, and without manipulation, right? I just say, take three deep breaths right now. Okay, awesome. Now, when it comes to breath work, to get to a state of calmness, typically what that includes or what that entails is that a person is able to pull air into them slowly, get that air to reach their belly, have the belly expand out as they inhale, and then go in as they exhale. And so, if a person is engaging in shallow breathing, as in their breath only reaches their chest, and it's only their chest that moves, or maybe it doesn't move at all, right? Maybe I don't see any movement happening, or the person's breathing does the opposite, as in, like, when they inhale in, their stomach goes out, and when they exhale, their stomach goes in. These are cues that potentially this client might not connect to a relaxed state, or that they might have difficulties with the relaxed state, right? And so that is typically how I'll start with breath work, is just the general assessment of, let me see how you deep breathe, right? Then if I start to structure, and it's typically like a spectrum, right? Like I try to increase the, I don't know if challenge is the right word, but increase the structure, the manipulation of the breath a little bit over time, right? So I see unstructured first. How do you do your deep breathing? Okay, next, then I add a little bit of structure. And the little bit of structure is to inhale through the nose and then exhale through the mouth. So, and then I'll demonstrate, and I'll typically demonstrate the pacing that I encourage to do. So like it's really meant to be deep and slow. And I'll show y'all so that way you can see too. So inhaling and exhale. Inhale and exhale. Okay. And so I typically try to exaggerate a little bit more the breathing, right? So I might try to puff out my stomach just a touch more, make a little bit more sound, just so that way the client can really see and hear the breathing, because again, we're remote, and so it makes it a little bit more difficult to notice these details, right? But that is the first step of structuring that I'll give. Then there is the next piece, is to uh do an inhale, hold the breath, then an exhale, then hold the breath. So, and again, this is if I'm to add a little bit more structure. This is typically what I encourage. So, and again, I'll demonstrate. So inhale, hold, and exhale, hold, inhale, hold, and exhale, hold. And then from there, if the person wants more structure, if the person is ready for more structure, then we'll do what's called square breathing, right? So that's inhale for a count of 4, hold for a count of 4, exhale for a count of 4, hold for a count of 4. No, it's a little bit more difficult to do the breathing and counting at the same time. So typically, if we're doing this in session, I'm not going to do the breathing with them. I'm typically just going to guide them through it, right? So I'll just demonstrate as if you were to walk through this, right? Oh, and I meant to say this at the beginning, but feel free to go back and do the breathing techniques that I'm talking about and kind of experiment with yourself and see how it feels for you. Again, when we learn our own body, it helps us better understand how to guide others through their body, not because everyone's the same, but because we can pull from similar experiences, right? So, yeah. So square breathing, if I'm guiding someone through it, it's inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. And typically I'll do anywhere from 3 breaths to 5 breaths, right? And I'll even highlight to clients how little time it takes. So oftentimes it's like, oh, it takes too long. And it's like, we did 3 to 5 deep breaths and it took less than 2 to 3 minutes, right? Like, and I've been doing this for a while at this point, and I kid you not, it's never been, honestly, probably no more than a minute, but I like to round up a little bit and say 2, 3 minutes, right? Point is, it's never been more than five, although you can do deep breathing for 5 minutes. Besides the point, just making it more accessible, right? Let's go on to the next element, which is water. And so the whole point here is to turn on your relaxation response. And so apparently there's research that shows that when you produce more saliva, it typically gets you into the calm part of your nervous system. And so you can either instruct the client to intentionally make more saliva. So I'm gonna do it. I encourage you to do it too. So try to make more saliva right now. Okay, so either encouraging the client to make more saliva or to drink water or to have tea, non-caffeinated tea, right? Just because we're trying to calm, caffeine's a stimulant, it might be counterproductive from what you're trying to do. And I mean, that's why, so like drinking water and tea, that's why it tends to be so powerful, is because it tends to encourage the client to naturally make more saliva. And then the fire part is to use the imagination or yeah, is to activate the imagination. And that is a great segue into resourcing. So, and this is where we guide the client or encourage the client to think about or recall people, places, memories, times, experiences, whether real or not, that help them feel rested, grounded, happy, strong, any type of feelings or sentiments that we're trying to encourage the client to do, to connect to. And why that's so important is because when processing hard experiences within therapy or outside of therapy, or a client is triggered, the clients can then go to these spaces or to these memories or insert whatever that promote these feelings to give them a break or reprieve or encouragement to keep going, right? Or to remind them of their own strength and resiliency. Excuse me. And so common resources that folks can lean into is secure spaces, wise figures, protective figures, nurturing figures, right? Um, so not only recalling these people, places, memories, things, but also embodying whatever it is that you're recalling, right? So, um, for example, for me, um, I'm gonna use someone that y'all know, right? Gabby. So Gabby is one of my best friends. For the folks that don't know, Gabby is one of my best friends, and I would consider her a safe person, a safe place, a safe connection for me, right? The client can choose whatever language works for them. So if I were to embody, right, this connection that I have with Gabby, it's not just about me thinking about Gabby, but maybe thinking about a specific memory and then remembering what was happening in my body in the moments that I've been with Gabby, right? Or in the moments that I've felt safe or that I felt creative, right? And it's like, okay, if I'm my own client and I want to describe it, I would say, my chest is calm. I remember my shoulders feeling loose. I feel energized, right? And they can even tap into their senses too, right? Like, so as I'm recalling these memories, I could also be remembering the perfume that Gabby wears, right? Or how or like if I'm recalling a specific memory, I can even remember my own perfume or just how I was dressed in that moment, right? So it's about not just recalling and naming these people, places, things, but also getting all of the senses activated as much as possible so that way the client knows what relaxation, safety, strength feels like. Then for discharge. So discharge, this is where the theories will become the theory that you're using will guide how to support a client through discharge. Now, this is where if you don't have the particular training of a theory, that it's discouraged to try anything too, how do I say this? If you don't have the particular training, don't try to exemplify the theory itself, right? Like EMDR, for example. That is specific criteria in which you go through, like there is literally structures in place on how to guide a client safely through discharge, right? So if you've not had the EMDR certification or the training, then it is discouraged from you to even try to do so, right? Like you might be able to watch an EMDR practice session or a real session even, but do not attempt it without going through that certification process. But example, and that's not to say that you can't still walk a client through discharge in session. So this is where you can kind of use a more trauma informed lens and really the knowledge that you have of your client. And it's important to gather that data first before trying to guide a client through discharge, right? So like how that can look like or how I've done it in session is again, this is with clients that I've learned about them for a while. I have attunement to their body or as best as possible or as we can through the virtual space. We have built the resources beforehand, like calmness, coping techniques, whatnot, and so, and they've shown that they're open to being challenged, right? So it's with these like so with this criteria, for example, I will encourage a client. So like as we're talking, as we're processing a particular memory that might be distressing, I will ask the client to detail more about the experience that's coming up, right? Either detail more about the experience that's coming up or detail more about what's happening within their body. If I'm noticing something physical, and again, I feel like it's safe for the client to do so, I will tell them, lean into it, right? Or go with it, right? So as an example, if a client is getting tearful and they say I'm noticing I'm getting tearful, I'll say in response, turn towards the tears. What are the tears telling you? Right? Or I'll say, let them fall. Right? Or I think there's at one point I asked someone like, what's happening in your body? And they're like, I want to scream. And they were in the safety of their own home, by themselves. There was nothing wrong. Or not, there was nothing wrong. What am I saying? They were safe. They were safe. They didn't have anywhere to go. They weren't disturbing anyone, right? So they're like, I feel like screaming. And I'm like, so scream, scream. And they did. And then um they kept talking, right? And they were crying. And then they became relaxed. And and then we moved into integration of like, how was that for you, right? Processing. I'm getting a little bit ahead of myself, but point is, I hope you get the general gist of how you can do discharge without necessarily having the theoretical training, and you can still practice within your scope of expertise, right? But full disclaimer, I have done a lot of body-based work, right? Like I've done yoga, meditation, like breath work, like I've done all of these things on my own. I have gone to trainings for them too, I'm not unfamiliar with this. So I think that's another piece to navigate too, is that this is not unfamiliar territory, even though I don't have like a certification in a particular theoretical orientation. Um yeah, and then titration and pendulation are specific somatic therapy strategies that are kind of similar. So pendulation is where you go from, like I said earlier, the therapist intentionally moves someone from the different states of the nervous system. So calm, elevated. And so it's to help build that tolerance and the empowerment that a client can get through these fluctuations, right? And then titration is where a therapist will guide a client through small doses of a particular trauma memory. And then, um, so things that are, oh, and then I didn't do anything for integration because this is where, again, traditional talk therapy comes into play, right? So what does processing look like? How do you, like all of the not motivational interviewing, what am I saying? I feel like you know what I'm saying. And if you don't, feel free to send me an email and I can explain more. So added recommendations that are kind of related to somatic therapy, but not necessarily somatic therapy itself. So the Burnout book by Emily and Amelia Nagoski. This book explains the science of the body and how and why stress and emotions form, and even the connection between emotions and stress. And then it provides practical steps or options to help folks release the stress that's occurring in their body. And again, it is scientifically backed. I believe one of the sisters has a background in research. Next is a link that guides folks through the four elements technique, as well as provides examples of each part or each element. Polyvagal theory is, I believe, like a biology-based theory that explains the three parts of the nervous system and what happens to the body within the three parts of the nervous system, and explains how and why, again, at a scientific level, folks experience distress or have fluctuation in distress, right? So, that is, included a website that gives more in-depth information on the polyvagal theory and how to use it, right? Next, I recently did a training that was centered around the overlap between the body and the mind, but not from a somatic therapy perspective, but from a like nutrition point. And so it's talking about how to look at your sleep, food intake, hydration, movement from the perspective of how can you use those core four needs to help promote a more stable, fulfilling, or satisfying mental state, right? Like, how can you make your sleep, your eating work for you and help you feel better, right? And so, if you Google fuel your brain, it'll lead you to the website that's in the parentheses. And this website was created by the expert that did this training. The training was on PESI if you want to like take a look at it. And yeah, and it provides practical resources and YouTube videos, informational videos on how to maneuver or how to adapt your um, habits in a way that work for you. And then other, how do I say this? Other resources that are not necessarily just therapy based, but that are helpful are things like yoga, breath work, mindfulness, and you can Google things like guided meditation, sound baths, Reiki, acupuncture, a lot of these non-Western, so like more Eastern medicines, right? Like these are typically, or these are healing practices that incorporate the mind and body within them. And Soma IQ, for example, has a bunch of free trainings surrounding breath work, right? So, like, I've done a few of their trainings where they walk you through breathing techniques and a particular structure that they have created. And Soma IQ actually is trying to get APA accredited currently. They have a research partnership, I think that's what it's called, but they're working with Arizona State University to become APA accredited. So that way it can be recognized within the psychology world. Um, and then, like I said, looking up guided meditation, sound baths, so like Spotify, YouTube has all these different things. Um, and then the Finch app is a self-care app. And so it basically is what it is a little bird that that you take care of. And so, like, it has activities for you to fulfill, but those activities are activities that are for self care, right? So, like brushing your teeth, taking 3 deep breaths, going outside, meditative moments, dance break, what you can tailor it to your liking, right? And so, every time you mark something off your list, you are taking care of your bird and in turn taking care of you, right? So, that's the Finch app. And then the Nourishly app was built by nutritionists specifically to help folks that have a history with disordered eating habits. Because oftentimes, uh, folks who have disordered eating habits have challenges with um, monitoring their food and movement and themselves in a non-regimented way, as in like people can like it could be tracking their eating can fuel the habits that are harming them, right? And so Nourishly, you can track your food by simply taking a picture. You don't have to put any measurements in. And you get to tailor what you are recording, right? So you don't have to record any one particular thing. And then on top of all of that, it has things like where you can track your mood, you can track your movement, you can I think there was even like a journaling component, right? And then depending on if the person has a nutritionist, there is the potential that the nutritionist has a Nourishly account, and then, so whatever the person logs, if they want their nutritionist to have access to that information, they can then have that, they can have their nutritionist connect to their data. So it just depends on the person. And yeah, I think that is everything. So this is the information that I used. I'm gonna stop sharing the screen.